Have you ever thought about the unseen threats to our health that lurk within our bodies? How about high blood pressure, a silent yet deadly killer? Yes, today, we're diving deep into the world of high blood pressure, a condition that many of us may unknowingly live with. High blood pressure, medically known as hypertension, is a condition where the force of the blood against the walls of the arteries is consistently too high. Now you might ask, why is it referred to as the silent killer? That's because it often presents no noticeable symptoms. You could have high blood pressure for years without any evident signs, but all the while it's wreaking havoc on your inner workings. It's like an invisible enemy, quietly causing damage to your body, especially to your heart and blood vessels. It increases the workload of your heart, forcing it to pump harder to circulate blood. Over time, this undue stress can lead to heart disease, the leading cause of death worldwide. But that's not all. High blood pressure is also a significant risk factor for stroke, kidney disease, and other severe health complications. The danger of hypertension lies in its silence. It's a sneaky adversary that doesn't play fair. Unlike other conditions that alert you with pain or discomfort, high blood pressure is a master of stealth, silently damaging your body's most essential systems without triggering any alarms. It's this ability to remain undetected that makes it a silent killer. However, it's not all doom and gloom. The good news is that with early detection and proper management, the risks associated with high blood pressure can be significantly reduced. Regular checkups and a healthy lifestyle can go a long way in keeping this silent killer at bay. So, if high blood pressure is a silent killer, how widespread is this issue exactly? Stay tuned as we delve deeper into the unseen epidemic of high blood pressure in our next segment. High blood pressure, as it turns out, is more common than we might think. Let's put this into perspective. Imagine a bustling city filled with diverse people, each with their own unique stories. Now consider this. 1 in every 3 adults in cities just like this all around the world has high blood pressure. That's a third of the global adult population. Quite a staggering figure, isn't it? Now let's focus a bit closer to home. In the United States, this condition affects a whopping 45% of adults. That's nearly half of the adult population. It's like filling up the entire city of Los Angeles and then some, with people who have high blood pressure. What's even more alarming is that many of these individuals aren't even aware of their condition. It's as if they're walking around with a ticking time bomb, unaware of the potential danger they're in. So why is this? Well, high blood pressure, also known as hypertension, is often referred to as the silent killer. It typically doesn't cause noticeable symptoms, even when it reaches dangerously high levels. This is why many people live with the condition for years without knowing it. They may feel perfectly fine on the outside, but on the inside, their bodies are under a constant state of stress due to this uncontrolled pressure. This lack of awareness is part of what makes high blood pressure such an unseen epidemic. It's not something that can be seen or felt, but it's there, lurking in the shadows, affecting millions of people worldwide. So it's clear that high blood pressure is a global health concern that warrants our attention. It's more than just numbers on a screen during a routine doctor's visit. It's a serious condition that can lead to severe health complications if left unchecked. But what exactly does high blood pressure do to our bodies? That's a great question, and one that we'll delve into in the next segment. Stay tuned. High blood pressure may be invisible, but its effects on our bodies are far from it. Just like an overinflated balloon, when your blood pressure rises too high, your arteries may become damaged or weakened. This damage can lead to the development of various health complications, each more daunting than the last. Firstly, we have heart disease. High blood pressure can cause hardening and thickening of the arteries, a condition known as atherosclerosis. This can lead to a heart attack or heart failure, as the heart has to work harder to pump blood through these narrowed arteries. In the United States alone, heart disease is the leading cause of death, and high blood pressure plays a significant role in that statistic. Next, let's talk about strokes. When blood pressure is too high, it can cause blood vessels in the brain to burst or leak. This can also block the blood flow, leading to a stroke. The scary part is, most people don't even realize they're having a stroke until it's too late. Then there's kidney disease. Our kidneys play a vital role in filtering out waste from our blood. High blood pressure can damage the blood vessels in the kidneys, making filtration less efficient. Over time, this can lead to kidney failure. Eye problems are another concern. Hypertension can damage the vessels supplying blood to your eyes, affecting your vision. It can even lead to blindness if left untreated. Lastly, there's the risk of sexual dysfunction, a topic that's often overlooked. High blood pressure can lead to erectile dysfunction in men and lower libido in women. It's a sensitive subject, but one that can significantly impact quality of life. These are just a few examples of the health complications associated with high blood pressure. Each one of them, a potential life-altering condition, and yet, high blood pressure often goes undetected until it's too late. With such serious health risks, why does high blood pressure remain so common? High blood pressure isn't just a random occurrence, it has identifiable causes. Let's delve into these, shedding light on this common yet often misunderstood health concern. One major factor is diet. Consuming too much sodium, found in high amounts in processed and fast foods, can cause the body to retain water. This increases the volume of blood, which in turn raises blood pressure. Similarly, a diet lacking in potassium can unbalance the amount of sodium in your cells, leading to high blood pressure. Consuming too much alcohol can also raise blood pressure levels, while a diet rich in fruits, vegetables, and low-fat dairy products can help keep blood pressure at bay. The second culprit is a lack of physical activity. Leading a sedentary lifestyle can lead to weight gain, which places additional strain on your heart, causing your blood pressure to rise. Regular exercise, on the other hand, helps maintain a healthy weight and keeps the heart strong and efficient. Thirdly, we have stress. Experiencing high levels of stress can temporarily increase blood pressure. If you turn to unhealthy habits to cope with stress, such as overeating, smoking, or drinking alcohol, it can cause long-term blood pressure issues. Lastly, there's the genetic component. High blood pressure can run in families, suggesting a genetic predisposition. If your parents or close relatives have high blood pressure, you're more likely to develop it too. So, as we can see, high blood pressure isn't just a numerical value on a medical chart. It's a complex condition with multiple influences, ranging from our daily habits to our genetic makeup. It's not a guarantee, but a possibility that can be influenced by our choices and our environment. We've looked at diet, physical activity, stress, and genetics as common causes. But it's important to remember that these aren't the only factors. Other conditions like kidney disease, hormonal disorders, and certain medications can also contribute to high blood pressure. Knowing these causes, can we do anything to prevent or manage high blood pressure? Stay tuned as we explore the answers in our next segment. Fortunately, high blood pressure is not an inevitable fate. It's true, this silent killer, this unseen epidemic, can be averted and managed with some proactive steps. Let's start with lifestyle modifications. The first step is to maintain a healthy weight. Obesity is a significant risk factor for high blood pressure, so keeping the weight in check is essential. Incorporating physical activity into your daily routine can help you achieve that. Just 30 minutes of moderate exercise like brisk walking 5 days a week can make a significant difference. Next, let's talk about diet. A diet rich in fruits, vegetables, whole grains, and low-fat dairy products can lower your blood pressure. It's also crucial to limit sodium in your diet. Too much sodium can increase blood pressure, so try to keep it under 2,300 milligrams a day. Alcohol and tobacco can also raise your blood pressure. Therefore, moderating alcohol consumption and avoiding tobacco can be beneficial. Now, on to medical interventions. If lifestyle modifications are not enough, medication might be necessary. There are several types of drugs available to treat high blood pressure, including diuretics, beta blockers, and ACE inhibitors. Each works in a different way to lower blood pressure, and sometimes a combination of drugs is used. Remember, it's important to work closely with your healthcare provider to find the best treatment plan for you. Regular checkups and monitoring of your blood pressure are vital. It's also important to take your medication as prescribed and report any side effects to your doctor. Lastly, stress management plays a crucial role in preventing and managing high blood pressure. Techniques such as deep breathing, yoga, and meditation can help to reduce stress levels and consequently lower blood pressure. So, we see that high blood pressure is a common but manageable health challenge. This is not a battle you have to fight alone. With lifestyle modifications, medical interventions, and a little support, you can take control of your blood pressure and lead a healthier life. Knowledge is power, especially when it comes to our health. In the vast constellation of our well-being, one of the most brilliant stars is awareness. It's the beacon that guides us, that allows us to navigate the complex labyrinth of health. And when it comes to high blood pressure, this awareness is not just a luxury, it's a necessity. Imagine for a moment a pressure gauge. It's an unremarkable device, but it's indispensable. When attached to a system, it provides vital information about the internal pressure. Too high, and the system is at risk. Too low, and it may not function properly. Our bodies are no different. High blood pressure, often called the silent killer, is a critical indicator of our internal health. Yet without regular checks, we remain oblivious to its presence. But why are these regular checks so essential? Well, think of it as routine maintenance for your body. Just as you wouldn't drive a car without occasionally checking the oil, you shouldn't navigate life without a regular understanding of your blood pressure. These checks provide a snapshot of your health, a window into your body that can reveal potential issues before they become serious problems. Yet, awareness extends beyond the physical. It encompasses our lifestyle choices, our diet, our activity levels. It's understanding the relationship between these factors and our blood pressure. It's recognizing that a high-sodium diet or a sedentary lifestyle can elevate our blood pressure. It's acknowledging that stress can be a contributing factor. It's the realization that these elements, often within our control, can influence our health. So, let's take the step towards awareness. Let's make regular blood pressure checks a part of our routine. Let's understand the factors that contribute to high blood pressure and make the necessary lifestyle modifications. Let's not be passive observers of our health, but active participants. Being aware and taking action can make all the difference in the world. Today, we've journeyed through the silent world of high blood pressure. We've navigated the unseen epidemic that affects millions globally and explored its profound impact on health. High blood pressure, often going unnoticed and untreated, is a pervasive condition that can lead to severe health complications, including heart disease and stroke. We've delved into the causes of high blood pressure, which are multifaceted and often intertwined. They range from genetic factors and age to lifestyle choices such as diet, physical inactivity, and stress. Understanding these factors is crucial in recognizing the potential risk and taking necessary precautions. One of the most critical aspects we've discussed is the prevention and management of high blood pressure. Simple changes in lifestyle can significantly reduce the risk. Eating a balanced diet, keeping active, maintaining a healthy weight, reducing salt intake, and limiting alcohol consumption are all steps in the right direction. Regular health checkups are also necessary to monitor blood pressure levels and detect any changes early. We've highlighted the importance of awareness in combating this silent killer. Knowledge is power. Being informed about high blood pressure, its potential consequences, and the steps to prevent and manage it empowers us to take charge of our health. Finally, we've emphasized the significance of vigilance. Regular monitoring, understanding the signs and symptoms, and seeking medical advice when necessary are all vital in managing high blood pressure effectively. In conclusion, high blood pressure, the silent and unseen epidemic, can have devastating health impacts if ignored. But armed with the right knowledge and tools, it's a condition that can be managed effectively. Remember, your health is in your hands. Stay informed, stay vigilant, and stay healthy.